Some of the most serious threats to women's health are not caused by bacteria, viruses, or genetics. They are caused by harmful practices society has normalized for generations. These practices quietly damages the bodies of women and girls, our mental health, and life expectancy. My name is Mira. I'm not smiling today. You're welcome to my channel anyway. Everything discussed in this video is based on established medical knowledge, public health data, and real health outcomes seen in women every day. I've worked in the hospitals. I know what I'm talking about. This video is not about the blame game or culture shaming anyone. It's about protecting women's health and its facts. The first on my list of most gory actions that needs to be eliminated this new year going forward is FGM, female genital mutilation. This involves the partial or total removal of the external female genital organs for non-medical reasons. And from a medical standpoint, this practice has zero health benefits and causes extensive harm to the girl child. Immediately, when it's done, FGM can cause hemorrhage, infections, and shocks. And in environments where sterile equipment were not used, the risk of tetanus and sepsis is very high. Long term, there's scar tissue that alters the female anatomy, leading to chronic pelvic pain, difficulty urinating, recurrent urinary tract infection, painful sexual intercourse, infertility, and severe childbirth complications. During labor, rigid scar tissues increase the risk of prolonged labor, perineal tears, postpartum hemorrhage, and fetal distress. Psychologically, many women experience lifelong trauma, including anxiety, depression, sexual dysfunction, and PTSD. FGM is a harmful, deadly tradition that has permanently harmed the body of girls and women, and it needs to stop like yesterday. It shouldn't have even crossed into the new year. The second on this list is child marriage and early forced pregnancy. When girl children are married off and forced into pregnancy before their bodies are fully developed for such activities, their risk of death and disability increases significantly. The adolescent pelvis is very, very narrow. It's not wide enough for safe vaginal delivery. This underdeveloped pelvis would lead to obstructed labor. Without timely surgical intervention, this can result in vesicovaginal or rectovaginal fistula, which is the continuous leakage of urine or feces from the private areas. Infections would occur, there will be social isolation, and severe psychological distress. Early pregnancy also increases the risk of hypertensive disorders in girls, severe anemia, postpartum hemorrhage, and maternal mortality. Babies born to young mothers face higher rates of premature birth, low birth weight, and neonatal death. These conditions are easily preventable and avoidable. Child marriage or child bride movement should stop now. The third on this list is denial of girl child education. Education is one of the strongest protective factors for women's health. I'm able to have a YouTube channel and speak medical and health truths because I am educated. I was given an equal opportunity to achieve my educational goals. And I believe education is one of the fundamental human rights. Girls being denied education are less likely to understand reproductive health, contraception, nutrition, and early warning signs of illness. This increases the rates of early pregnancy, unsafe abortion practices, untreated infections, and maternal mortality. Educated women are more likely to access antenatal care, deliver with skilled birth attendants, and vaccinate their children on time, and also seek medical help when needed. When education is denied, women lose not only opportunity but also health and survival. Educate the girl child today. The fourth on this list is harmful widowhood practices. In some societies, widows are subjected to rituals involving isolation, deprivation, forced cleansing, and accused of wrongdoings. These practices exposes women to malnutrition, dehydration, infection, and severe mental health consequences. Social isolation during grief. Can you imagine that she just lost her husband, and in this period you isolate her? This can increase the risk of depression, anxiety, suicidal ideation, and worsening of chronic illnesses like hypertension and diabetes. Grief is a vulnerable period. Adding harm during this time worsens both physical and psychological outcomes of the woman. It needs to end immediately. The fifth on this list is gender-based violence, normalized as discipline. God. this is annoying because violence against women, whether physical, sexual, or emotional, is often minimized or justified in certain societies. Medically, repeated trauma causes chronic pain syndromes, fractures, internal injuries, reproductive tract injuries, and disabilities. Sexual violence increases the risk of sexually transmitted infections, unintended pregnancies, and gynecological complications. Psychologically, chronic exposure to violence dysregulates stress hormones, leading to anxiety, depression, PTSD, sleep disorder, hypertension, cardiovascular diseases, and weakened immune function. Violence is not discipline. It is a serious public health issue that needs to end now, because statistics have shown that the number of women that has died as a result of gender-based violence is alarming. The sixth issue on this list is son preference and neglect of female children. When male children are valued more than female children, girls often receive less nutrition, delayed health care, and reduced attention. This leads to higher rates of malnutrition, anemia, growth retardation, untreated infections, and preventable childhood deaths among girls. This act is very awful and needs to stop immediately. The seventh on this list is unsafe traditional birth practices. Discouraging the use of skilled medical care during childbirth exposes women to preventable complications. Untrained birth attendants may not recognize obstructed labor, fetal distress, postpartum hemorrhage, or infection. Delayed quality care and delayed referrals increases maternal and neonatal mortality. Evidence consistently shows that skilled birth attendants and emergency obstetrics care dramatically reduces the rates of deaths of women going through labor and childbirth. Unsafe birth practices are dangerous, and it ends today. The next on this list is menstrual shaming and period poverty. Menstruation is a normal biological process, yet stigma forces many girls to manage it unsafely, using unclean materials, increasing the risk of reproductive tract infections, pelvic inflammatory disease, infertility, and chronic pelvic pain. Missing school during menstruation affects education, self-esteem, and long-term economic stability. We need to make basic menstrual hygiene products readily available and affordable so that no girl would have to put her life on hold or deal with unsanitary products, especially during periods like this. The ninth point on this list is forced silence around sexual abuse. When sexual abuse is silenced, survivors are denied timely medical and psychological care. Delayed treatment increases the risk of untreated sexually transmitted infections, HIV, unintended pregnancy, chronic pain, depression, PTSD, and substance abuse. Silence allows harm to continue across generations. Also, this shouldn't be a reason for malicious women to come up with such accusations in order to tarnish anyone's image. By falsely accusing someone of sexual abuse, you'll be depriving actual victims the justice they deserve. Last on this list is the economic disempowerment of women. Economic dependence limits access to health care, adequate nutrition, and safe living conditions. Women without financial autonomy delay medical care, remain in abusive environments, and experience worse outcomes in chronic diseases. Economic empowerment is very vital, so please empower the girl child today. These practices persist because they are normalized and seen as tradition, and in some cases backed by religion. Protecting women's health requires education, policy changes, and courage. When women are healthy, societies are healthier. An educated girl is an educated generation. Let's continually advocate with our voices, and we will surely bring an end to these evil acts. Adequate and affordable women's health is not optional, and silence is not protection. Subscribe to my channel, like and share my content, and I'll see you in the next video. Until then, speak up for the girl child. Bye bye.